Hi, welcome to another edition of This Issue. My guest this time is Jerry Call, who's from Rockland and is a leader of the group called Maine Healthcare Reform. Jerry, welcome to the show.
Bruce, thank you for having me.
You're welcome. Great to have you here. Now, I understand you're a carpenter by trade.
That's correct.
You're not a full-time activist or anything like that. You, 6 months ago, laid down your tools, your income, and said, I'm going to work on this single-payer healthcare thing for a while.
That's correct.
And give it my life for 6 months. Why did you decide to do that?
Well, I felt it was just a crucial time with the bills coming up in Congress, and I just felt that this was our biggest shot since Roosevelt or Johnson, and so I just felt that it was imperative to do that.
And tell us about the group that you're with, Maine Healthcare Reform.
Right. We started that about 2 years ago. Four friends of mine and I, we had been watching the Kucinich debates, and or when Kucinich was running for the presidency then. And that was really the first time we had heard of this national single-payer healthcare concept. And so when he was shut out of the debates and later and kept from talking about it, we decided to look into it a little bit more and decided to pick up the cause. And
so you started the group, you and some friends?
That's correct.
And you were still working at that time?
Yes, I was working all that time. And
what made you decide ultimately again to just lay down your tools and carpenter tools and jump in?
Well, once we sort of talked about getting this thing started, it occurred to me that a number of years prior to that I had undergone surgery for cancer. It was a stage 3 cancer. And I remember sitting in the doctor's office and saying to myself, like we oftentimes say, if I can just get out of this situation, I'll do anything. And so at that time, I specifically remember saying, if I live through this, then I will find a way to pay back to society for my good fortune. And then through the conversation with my friends, I said, boy, this is it. And this is what I'm going to do, and I'm going to fulfill my promise.
Wow, that's great. So what exactly is single-payer health care? And tell us about exactly what that means.
Right. Single payer means that there's just one entity that pays the bills for health care. It's done a little bit differently in different countries around the world, but basically what is proposed here is that the government would fund and pay for, like they do Medicare, for all the health care, and it wouldn't be run through the insurance companies, and therefore it would be much less expensive.
So Medicare for all, basically.
That's correct.
What do you have against the insurance companies?
Well, the problem is they don't really add anything to the healthcare situation. They only take it away. Keep in mind that nowadays, for every $2 that we spend and actually give to our doctors and nurses and hospitals, we spend an additional $1 and pay that to the insurance companies and all of the administrative people and tasks that they require to keep their system going. So we could increase our spending on actual health care by 50% if they were not in the picture.
So Medicare then is more administratively cost effective?
Absolutely. I mean, that's the big reason why this country spends twice as much per person or per GDP, if you will, for health care than any other industrialized nation.
And the insurance companies are happy to keep it that way, correct?
Well, they're doing their job. I mean, their responsibility. They have a fiduciary responsibility to maximize profits, and so they have absolutely no incentive to make the system better or to step aside.
Well, today we've got 46 million Americans without health care, and that number's growing because of all the people losing their jobs around the country.
And another 47 or so that are underinsured.
So we've got more demand for health care today with people that can't afford to buy an insurance policy, correct?
That's correct.
So how are we going to pay for this single payer program? You know, some people say, well, you know, you get the government involved and it's going to cost a lot of money. Yeah. How do you answer that question?
Well, the irony is, and I really find this interesting, is that what Senator Baucus and the Congress are talking about is spending an additional $1 trillion on our healthcare system, on top of the fact that we already spend twice as much as anybody else. Whereas this system, the single-payer system, knocks out all of that administrative and profits, of course.
And advertising.
The advertising, the marketing, and all that. When you take all that away, we can spend the exact same number of dollars that we do today, no more, and cover everybody and cover them better. Those 47 or 50 million that are underinsured, they would be brought up to a good quality health care and preventative health care. So we don't have to spend any more in this country than we do already.
Now, recently I heard former Vermont Governor Howard Dean talking about this stuff on TV. And he said that President Obama is going to propose a combination health care plan, or what they're calling a hybrid, a cross between the public single payer, but also the private plan, and that they would give everyone a choice. You can have this one or you can have that one. Well, how do you feel about that?
Well, first off, to just refer back to what I said, that's going to cost $1 trillion with a T dollars to implement over a number of years, whereas our plan wouldn't cost another cent. So the only way that they can do that is to spend additional money. And when you when you take all the profits and so forth that the insurance companies are siphoning out of the system and not use that money to provide health care, then it's just not going to work. The dual system that they're proposing just isn't going to work. They think it's a nice compromise. They're claiming that it'll be a backdoor way to a single payer, but it's not going to, in my opinion.
So are you basically saying that healthcare is a human right and it shouldn't be a profit-making system?
Absolutely, and I think America's coming to that concept now. And even Obama came out some time ago and said, you know, it is a human right. And I think more and more Americans are accepting that. They certainly accept that fact all around the world, in the industrialized nations, anyways. So, yes, I think that's the case.
Well, the Congressional Quarterly recently reported that Senator Ben Nelson, a Democrat from Nebraska, said that he will oppose any legislation that would give people this option, this hybrid option.
Yeah. Public-private, I think.
Yeah. He went on to say that if that choice was given to the people, that they would take the public one rather than the private one. And he said, this is a quote from the Congressional Quarterly, Senator Nelson said, quote, "At the end of the day, the public plan wins the game. Including the public option in the health care plan," he said, "was a deal breaker." So he's even saying that he won't even allow this hybrid plan to go forward. So what does that tell us?
Well, that's correct. I mean, it's there's a lot of opposition to that, which is too bad. There's been a lot of effort to try to push this public-private option. Of course, no one is talking about what that public option is. It's all speculation. It could be as something as subdued as allowing people to become a part of the federal employee pool and buy insurance through the profit-making insurance companies, or it could be something like we will just subsidize your entry into Medicare, which of course is no one is going to support that.
So really the hybrid plan, the public-private plan, is just another way to keep the insurance companies in the whole thing.
That's correct, and it was worked up by mostly private corporations and so forth originally as a way to try to push this through. They didn't want to get caught up in the Hillary Clinton type of thing, and So organizations like Walmart and AT&T and those type companies, along with SEIU, decided that that might be a better approach. But as we can see, the insurance companies, they're not going to allow that.
Now, recently I read a quote from Nancy Pelosi that really knocked me out. She said, quote, "Single payer, single payer, single payer. That's all I hear."
Yeah.
Well, you're not going to get it.
Doesn't that tell you something about, our political process? When 60% of the people demand single payer in poll after poll, year after year, and she even admits it based upon those three statements, and yet they will not give the American people what they want.
Why not?
There's too much money, there's too much pressure by the special interests. And a lot of times we say the insurance companies, but when we say that, that's a shortened version of saying insurance, drug companies, medical equipment manufacturers. And so unless the American people go out there, Franklin Roosevelt had a great comment. He says, "I agree with your point 100%. Now go out there and make me do it." And basically that is what President Obama is telling the American people. I cannot step out there and carry this issue unless you're willing to go out there on the streets and make me do it, or really allow me to do it, and buck the special interests. There's no way I can do it. So it's really, at this point, it's up to the American people.
So what you're saying is that we have corporate domination.
Absolutely.
Of the healthcare system.
That's correct.
And that nothing is going to change unless there's a revolt, basically, of the American people.
Absolutely.
Now, the Obama plan, all right, he's not coming forward with single payer. I saw the other day he told a group at a town meeting that if I was, if we were just beginning this, that single payer would be the way to start. And when he was a state senator in Illinois, I know he supported single payer.
He did.
He was an advocate, but suddenly he's not, okay?
Yeah. Because he's got the pressure from the special interests. That's the only
So
reason.
what is the Obama plan? Break it down for us.
In his heart of heart, he wants single payer, but he can't go there. Basically, the Obama plan, there's two different ways of looking at it. He wants to have a parallel track. He wants to allow the American people, if they have insurance either through their corporate or their employer or through private insurance, they can keep that and keep all those profits and administrative costs flowing through the insurance companies. Or they can try to or they can participate in some kind of a public plan, which he has never elaborated on, nor has Senator Baucus elaborated on. So we have no idea what that public plan is. But as long as you try to run those parallel, you cannot wring out the marketing and administrative costs. It's only by going and cutting it horizontally can you do that. So for instance, like in Canada, when they first started out, they only had a national plan for the hospitals. Everything else was private insurance. So that's the type of thing, if we're going to compromise, and there are a lot of compromises out there for single payer. I mean, they try to paint the picture that single payer isn't willing to compromise. They are. The thing is that you've got to find a way of slicing it so that the insurance companies are cut out of a certain segment. As an example, let's say hospitals. Or they could take the other segment. They could take all of the primary care physicians and all of the preventive medicine and let the insurance companies have the rest of it. But as long as you've got the two of them side by side, you'll never get rid of the overhead.
Now, you've mentioned this name a couple times now, Senator Baucus.
Right.
Now, Senator Baucus is a Democrat from Montana, from the state of Montana. And he's the chair of the Senate Finance Committee.
That's correct.
And in the last couple weeks, he's held 3 hearings. And they've become very controversial, these hearings. He's held hearings on health care reform. He's had panels of dozens of quote-unquote experts come in.
Special interests.
Special interests, mostly insurance company people. And he's not allowed anyone, not one person, is this correct?
That's correct. Not one.
Not one advocate from the single payer program.
Even though 60% of the American people, and I'm talking about Time, I may have mentioned this, but Time, CNN, all of these different reputable organizations that run these polls come back time and time again and say, more than 60%. Actually, the physicians come in at 59%. Even here in the state of Maine, they just ran a poll that showed 59%.
Of doctors.
Of doctors.
Support single payer.
That's correct. And more than 60%. Usually it's up in the 60, 65, depending upon how the questions are asked, are in support of single payer. So that was why I went down to the third meeting in Washington last week and risked getting arrested by standing up at the beginning of his meeting and asking him publicly, because we had asked him privately, the Physicians for a National Health Program, of which I am a member, had asked him continuously, email, phone calls, everything, and he continued to deny.
You asked him what?
We asked him if we could have one seat at the table, one seat out of the 15. And he said there will be no single payer representation at this table.
Now, why is Baucus shutting out the single payer voices at a hearing? Now the president...
It really makes you wonder.
The president said that we were going to do things differently this time around. We were going to bring everybody in. We were going to have everybody participate. We're going to have all the voices across America talk about all these issues, that his administration was going to be different. Well, Baucus is basically carrying water, right, for the Obama health care plan.
Exactly right. Well put.
Then why are they keeping out the voices of single payer?
Again, it goes back to the influence that the special interest group have. I mean, we're talking overall a $2.4 trillion industry. 17% of our economy is based on the healthcare industry. Now, the insurance companies and special interests are a much smaller segment of that. The biggest segment is the running of the hospitals and doctors and so forth. But they have a huge chunk. I mean, they can, to drop $1 billion for them is chump change. So they can purchase a lot of influence.
Is it true that Senator Baucus is one of the leading, if not the leading, recipient of campaign donations from the insurance companies?
That's correct. That's correct. And so there's a lot of pressure. And unfortunately, the American people haven't gone public with their support. I mean, they do it in the surveys, but they don't go public. And that's why it's absolutely essential, because we only have about 60 days before the House and the Senate present their bill, for the American people to come out, put their feet on the street, and say, look, I'm here physically, and I'm telling you, Mr. President and Congress, I support single payer, and I'm gonna be on your back, and I'm gonna fight the insurance companies for you.
So on May 5th, and then again on May 12th, doctors and nurses and advocates like yourself stood up at these hearings. They called it, the Raucous Baucus Caucus or something like that.
That's right. Amy Goodman called that, and that was perfect.
But people stood up, and so there were, how many were arrested between these two different hearings?
We're now known as the Baucus 13. There were a total of 13 of us.
But there were doctors?
Doctors. The first group was almost entirely doctors and a couple of lawyers, but all professionals. I think maybe there were 2 activists or advocates during that original group. And then on the 5th, and then on the 12th, there were 2 doctors, 2 nurses, and myself were there.
You went to jail.
Right. Well, of course, as soon as we stood up and spoke and asked Senator Baucus why 60% of the American population was not allowed to be present at this or participate in that meeting, he immediately called for more police. If anybody saw the original video on the 5th, Dr. Margaret Flowers, who is a pediatrician, said, we want a seat at the table. And immediately Senator Baucus shot back and he says, I want more police. Oh. And that was his response to what the American people are asking for, just one seat at the table. So they and our group were both escorted immediately out of the room. We didn't put up any resistance. We said our piece and then we left. And then we were processed through the police department, the Capitol Police, and at which time we were offered the option to sign off on some paperwork saying that we would return for trial and so forth. But I felt it was very important to, since the first group of 8 didn't make a dent in Bacchus's opinion, that I felt it was important to take it to another level. So I refused to sign the paperwork and went to jail for an additional 25 hours or 24 hours.
Stubborn Mainer, huh?
Well, I'd like to think that I represented Maine well. I mean, I think we have a great independent spirit up here, and this is my first foray into doing any kind of protest. I was in Vietnam. I did my duty there. I went through ROTC and never got involved with the protests there because I was so busy trying to get a degree.
You were an officer in?
Yes, I was a captain in Vietnam.
In which branch of service?
Corps of Engineers of the Army.
Uh-huh.
Yeah, because I got my degree in engineering, so it was a good fit.
And you're a carpenter today.
Yes.
You 6 months ago decided, I'm going to quit work for 6 months. I'm going to throw in and try to make this single payer happen.
That's right.
And since that time, you've run into the wall. You've run into the wall of corporate domination.
Yep.
You're seeing that the corporations are not wanting to bend and not wanting to give a lick.
Right.
Do you think the American people understand that?
I don't think they do, because quite frankly, the mainstream media has done a fantastic job of keeping all of this out of the press. I mean, we got a little bit of press in mainstream media as a result, and that's why I did it. I mean, it was, like you say, we're up against the wall. We can't break through the media blackout. So I felt that at least maybe we could break through that blackout by going down and being arrested. So I hope shows like yours will get the word out and make people realize that President Obama, he cannot buck that system all by himself unless we go to the streets and show physically our bodies out there on the streets and say, look, President Obama, we're here, we're going to support you. That's what we need to do.
Now, one of the things that your group, Maine Healthcare Reform, is trying to do is to get the people in the state out on the street, and you're calling for a statewide rally in Augusta at the State House.
That's correct.
On Saturday, May 30th, from noon to 2 p.m.
Mm-hmm.
Now, what's the purpose of this rally, and why did you decide to do it in Augusta?
Well, we initially decided that we had to do it, and we wanted to do it in a peaceful fashion so that mainstream America could come and feel comfortable and participating in an open rally and not be afraid that they're going to get involved in some kind of a physical ruckus. And that's not at all what we're trying to do for this particular rally. But we felt it was important to give the citizens of Maine an opportunity to go out there and show their support to the president for this particular plan. So when we started planning it, we said, well, maybe we could do two. We'd do one in Portland and one in Bangor simultaneously. And we found we just didn't have the resources to do that. So we said, let's give all of Maine an equal opportunity to participate. And so we chose Augusta. And in addition to that, we've been very instrumental, certainly not the only force, but we were a big voice in getting the national organizations, the National Single Payer Alliance, to sponsor this event all across the country.
Oh, so this day, May 30th, is going to be protests all over America.
That's correct.
Oh, that's
correct.
great.
Right now, there are 30 locations signed up to do what we're doing, either specifically on the 30th or right around there. Some of them have elected to do it on Friday rather than Saturday because they want to protest in front of an insurance company or something like that.
Now, what about our congressional delegation, our 2 congresspersons, our 2 senators? Very quickly, how do they break down on this single payer issue?
Well, I have to give a huge congratulations to Shelley Pingree. She stepped forward, and she was one of the original 30 co-sponsors of the House version of the single payer bill, H.R. 676. Mike Michaud, unfortunately, continues to resist co-sponsoring that bill, which doesn't make a lot of sense because he's such a great supporter of unions. He's such a great supporter of veterans, the 2 groups that would really benefit probably more or at least equal to everybody else. Collins has adamantly said that that's nothing that she would consider. Surprisingly, and I was really heartened by this, and I've sent Senator Snow a letter asking her to attend the rally, because she said that even though as a Republican she would like to see a private enterprise solution to this thing, that she thought that it's very possible that only a national healthcare system will actually solve the problem.
So what are you asking people listening to this show to do to help on this issue?
It is absolutely critical that people show up on the 30th. I mean, that's just the beginning. But it's critical that people show up in Augusta on Saturday the 30th so that we can have a big crowd on which to build an even larger crowd over the next 60 days, because we've got to get a bill out of Congress, either the Senate or the House, to get a single-payer bill out.
And you're asking people to call our congressional delegation, Snow and Collins, and
No, actually I'm not, because I want them to spend the time that they would have spent on that to call their neighbors and their friends and their family to get them to Augusta on the 30th. After the 30th, there's all kinds of time to call all these people.
Okay,
I don't want them to waste their
about
time
after
now.
the 30th.
Yeah, after the 30th.
Some people are going to see this show after the 30th.
Oh, they will.
What do you want them to do after the 30th?
Then it's time to call your representative, whoever that might be, and tell them that they need to get on board and support single payer. Absolutely right.
Yeah. A 1 minute closing statement, Jerry. We're almost out of time, but you want to say something in closing, please?
Yes, once again, I just can't say it enough that time is very short. It's been, Roosevelt tried to do it in his time in the 40s. Johnson tried to do it in his time in the 60s. Hillary Clinton tried to do it in the 90s. If we, I know a lot of people don't agree with this, but this is our moment. This is a very crucial time. Nowhere in the last 17 years have we had this opportunity to solve our healthcare problem. And so I just urge and ask people to show up on the 30th, and then we can build it from there.
So in other words, we need everybody pulling the oars, right?
There you go. Yep.
Because this boat ain't going anywhere unless we get everybody on the oars, correct?
Absolutely. Thank you.
Yeah.
Yep.
Well, Jerry, thank you very much.
Okay, thank
for
you.
coming on the show.
Yep,
I
my
really
pleasure.
Appreciate it. And thank you for watching another edition of This Issue. Until next time, good luck to you all, and please get organized.